Hello, everybody. My name is Reza Pourmand, and I'm glad to be presenting today on leveraging AI to improve global access to skin disorder diagnosis. Before we start, here's a little bit about me. I'm a rising senior at Winston Churchill High School in Potomac, Maryland. At school, I'm the co-captain and co-president of the Science Fair Club, as well as the co-president of the Families for Families Club, where we run monthly food drives and make food to donate to a local homeless shelter. Outside of school, I'm a junior EMT at my local fire department and am a Taekwondo instructor at my local dojo. I'm interested in studying biology in college and aspire to become a physician specializing in cardiology. For my presentation today, I will first introduce you all to the field of dermatology, the background as to why people around the world lack access to dermatologists, the project I developed towards solving this problem, as well as the design, and finally the conclusion and future developments. So first of all, what is dermatology? Dermatology is a field of medicine that primarily puts a large focus on the diagnosis and treatment of various skin disorders, which includes both skin diseases and cancers. One of the most common forms of skin disease is acne, which, according to the Journal of the American Academy of Dermatology, affects roughly 1 in 5 individuals globally. Additionally, according to the National Institute of Health, generally a third of the global population suffers from some sort of dermatological disorder. In the United States alone, there are three key groups that lack access to dermatologists. Firstly, most dermatologists tend to practice in urban areas, which results in many rural populations having a lack of access to the services needed for proper diagnosis. Secondly, most dermatologists tend to work in regions that correspond to their own ethnic group. And since a small portion of ethnic minorities are dermatologists, this results in many of these individuals not having the ability to be diagnosed. Lastly, individuals with lower cost healthcare typically do not have of treatment as compared with individuals with higher cost healthcare, which results in diagnosis for such individuals being scarce. In many parts of the world, there is a severe shortage of dermatologists, with fewer than one dermatologist per million people in Africa and only about 9.5 dermatologists per million people in India. Similar to the United States, many dermatologists globally are concentrated in urban areas, leaving rural populations with a lack of access to the services necessary for treatment, let alone diagnosis. Furthermore, according to the Journal of the American Medical Association, or JAMA, skin cancers are one of the most commonly reported cancers, with melanoma being one of the most prominent. Due to increased exposure to ultraviolet radiation, melanoma cases in Europe have risen, with more than three-quarters of melanoma cases being attributed to ultraviolet radiation. The JAMA asserts that from 2020 to 2040, if exposure to UV radiation increases, there will be an approximate 50% rise in melanoma cases and 68% rise in melanoma-related deaths worldwide. Due to the widespread difficulty many people face in having access to a dermatologist, my idea was to create a smartphone app that makes early detection more accessible. Using AI and image recognition, the app allows users to upload photos of their skin, which are then scanned to identify whether a skin condition is present, and if so, to classify the specific type. According to the Global System for Mobile Communication Association, in 2023, approximately 4.3 billion people worldwide own a smartphone. This means that through the devices they already have, billions of people could potentially access AI-powered health tools. By leveraging machine learning to recognize and differentiate between a wide range of skin diseases, cancers, and benign conditions, the app offers a cost-effective, accessible method for early screening, empowering individuals to detect issues sooner and potentially prevent serious outcomes. For the first part of my project, I needed to gather data and images from public datasets. I used Ham 10,000 and DermNet and then uploaded the images into RoboFlow, which is a platform that helps with annotation and labeling of images. Afterwards, the images were tagged with a skin disorder tag based on the file name of the image, which identified which type of skin disorder it was. Bounding boxes were then annotated onto each image, indicating which sections of the image had the skin condition. To improve accuracy, the dataset was enhanced by resizing the images and applying augmentation techniques to introduce more variety. Once prepared, the images were then uploaded into the You Only Look Once, or YOLO, object detection framework. YOLO is a real-time object detection model that relies on convolutional neural networks, or CNNs, to process the images and recognize patterns. The CNN first scans the images using convolutional filters to search for edges, shapes, and textures. These patterns are then stored in feature maps to help the AI focus on important parts of the image. While other standard CNNs analyze images piece by piece, YOLO splits the image into a grid and makes simultaneous predictions, making it far more efficient. The app utilized AV validation to stream the live camera video for quality video recording. UI Kit was applied to construct the interface, making it easy to navigate and comprehend. The Vision library helped capture frame, which buffered the image during interference. The RoboFlow package library then runs the trained object detection model, identifying and highlighting skin conditions with confidence levels. Results are displayed in real time, allowing users to examine potential skin issues immediately. The object detection model was then tested on a batch of approximately 300 images containing various skin disorders. The model achieved an overall accuracy of approximately 80%. Detecting melanoma was observed to have the highest accuracy of about 95% and was ultimately the most important skin cancer solved, since it is the most prominent skin cancer globally. Overall, the model demonstrated success by being able to accurately identify skin cancer and other malignant diseases. By converting the model into an actual application, more people have access to skin screening technologies before seeking help. I envision to expand the model's abilities to be able to identify and distinguish between other types of cancers. Furthermore, I envision to add more data and consistently improve the accuracy of our model. Before I end, I want to leave you all with a question. How can AI be utilized in the future to improve global health? As technology continues to advance, AI and machine learning ultimately have the ability to massively change healthcare, from diagnosis to personalized treatment. By utilizing the numerous amounts of public medical data online from public data sets such as HAM 10,000, DermNet, and even Kaggle, and improving AI models, we can help mediate some of the most pressing global health issues. Now, these are my references and acknowledgments, and I would like to particularly acknowledge Troy, who helped me with making the model. If you would like to reach out to me about my project, you can reach out to me via email or you can reach out to me via my LinkedIn. Thank you for listening.